ma'am, with the threat of Omicron's, spreading, what is the methodology which has been designed to tackle that threat?
So I think India has been very progressive, very proactive, and extremely successful in the way that we have tackled COVID so far. Uh, we have had a sad loss of people, which is irreplaceable, and we will continue to feel that pain. However, in the same breath, we should celebrate the fact that our mortality rate is among the lowest. Our vaccination rate is extremely high. The daily number of cases remains under control. So I think that India is well geared. The amount of testing has been, we're able to scale up. The population is understanding the importance of masks and social distancing and able to combine now a methodology in their daily activities. And most importantly, that we have a significant portion of the population vaccinated, and I think there is a high degree of herd immunity. Now, Omicron and the COVID virus itself is new, is been changing, and therefore we can never completely predict the impact it is going to have. But if you all remember, I have continued to say that, a third wave could happen, but it is inevitable but mitigatable. And so I think every step for mitigation is being done. So we must continue to, as a society, practice this. And anyone who has not been vaccinated, please go and take your vaccination shots, not just to keep yourself safe, but to keep society safe, because we have to break the chain of transmission.
Ma'am, what are your views on a possible national health insurance for all Indians at this point of time?
So I think that we are inching closer and closer from the time we started health insurance. Apollo Hospitals has been committed to universal health coverage for the last 20 years. We started a not-for-profit society to propagate the need for health insurance because people cannot afford to pay for advanced healthcare out of pocket. We need a third-party payment mechanism. Now, this mechanism will be government or socially funded or private by a combination depending on the varying socio-economic capability of the population. But it is undoubtedly correct that the whole population must be covered. In addition to that, we must continue to innovate in terms of the type of products. Outpatient care, which is very important, should also be covered very soon. Higher amounts of coverage for dread disease like cancer and cardiac are also very important, so people should make sure they don't under-insure themselves. But if the insurers could get creative about a much smaller premium covering the entire population for major catastrophic illnesses, that would also be a good thing. But I think the sector is dynamic, the growth rates are high, and more people are getting aware. And of course, we must acknowledge the government's tremendous role in Ayushman Bharat and the proliferation of universal health coverage.
Ma'am, one final question. As you rightly said, the role of private sector, of course, has phenomenally increased, not only in urban but also in rural areas. But as far as affordability in healthcare is concerned, I mean, we have seen in the years of the pandemic that many underprivileged, of course, have struggled at dilapidated places due to lack of healthcare or due to costly healthcare. What are the reasons as of now behind that? And will that hinder the growth of the private sector as the time progresses?
So let us be very clear, it is very important for a country like India to spend more on healthcare. The allocation as a percentage of GDP must increase for healthcare, and I'm sure the government will take steps, having seen what the country has been through for the last 2 years. In the same breath, we should look at high quality but lower cost healthcare, and this is an innovation that digital, various other innovations in technology, as well as an integration between primary and secondary and tertiary healthcare, and a big focus on prevention. Because if you can prevent a disorder from becoming major, find cancer in stage 1 and not let it go to stage 4 where the costs are high. So this is a combination of multiple efforts that the public and the private must do together in conjunction with society staying healthy. And I believe that India is approaching this in a multitude of ways, including the advancement of primary health care, of health insurance, of the digital health mission, and private providers like Apollo and many others are looking at ways to keep quality high, to bring the latest technologies, but at the same time contain costs. So I think we're moving in the right direction. There's more to be done, but I'm very hopeful.
And thanks for speaking with ET Now.